Healthcare's greatest challenge isn't just treating disease, it's reaching patients before they become critically ill. Our next guest, Kent Dix, is revolutionizing this approach as CEO of Life365. With over 30 years of entrepreneurial experience and a pioneering legacy in mobile health science since 2006, Kent has dedicated his career to transforming reactive healthcare into proactive, predictive care. As a recognized thought leader who has testified before Congress on mHealth solutions for veterans, Kent combines deep technical expertise with an unwavering passion for improving patient outcomes. Through Life365's innovative digital health service as a platform and strategic partnerships with Microsoft, he's creating scalable solutions that connect patients, providers, and AI-driven insights seamlessly. Join us to discover how Kent's vision is shifting healthcare upstream, keeping patients healthy at home, and preparing our industry for the coming demographic tsunami. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Kent. A big welcome to our podcast today.
Hey, Mike. Thanks for having me.
Well, given your extensive experience as a pioneering thought leader in mobile health since 2006 and your passionate commitment to developing patient-centered telehealth solutions that address chronic care management through Life365's innovative digital health as a service platform, I'm excited to have this conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and X in order to further the conversations occurring on this podcast. All right, Kent, it's almost time for our community to learn how you and the Life365 team are pioneering virtual care technology solutions that enable healthcare delivery at home and provide scalable solution integration for enterprise healthcare organizations. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
You got to be absolutely passionate about what you're working on, what you almost have to go through and get paid for your hobby or thing that drives you every single day, right? From that, if it's not worth the passion to do that, then it's not worth doing it every single day.
It sounds like you have done this a bit, as I mentioned, on the front end since 2006. You've been at it for a while. Kent, you know, this is not the easiest industry to innovate in. However, the opportunity for change and making a huge mark on people literally around the globe is just incredible. I mean, we're talking about an individual's health, community health, etc. This is a huge opportunity to do good and do well. But as you mentioned, it is tough and you have to bring your A game. You have to bring your passion every single day. Kent, let's talk about a little bit of culture inside the organization. How important is that with your colleagues as well, not just coming from the CEO?
I think it's important that everybody get together and get along, right, from that as well. Again, that's part of a fun environment to be able to do it. Sometimes those are challenging. People should challenge each other along the way, especially when you're trying to break new barriers of new innovation to put stuff out there. We always used to say in this industry that hardware is hard, but healthcare is just as hard or harder, right, from that as well. They also say you want to be disruptors in the industry from that. And we learned a long time ago, it takes a lot to disrupt healthcare. It has its own pathway, if you could even disrupt it. So that's the hardest thing for Silicon Valley-based entrepreneurs to really get a hold of. In their world, it's about breaking things and moving fast, but that's really hard to do in healthcare. So you have to have a passion and you have to have a ability to stay with it for a very long time to get to the end result.
Well, thank you for teeing that up, Kent. We're going to talk about your passion. We're going to talk about your organization's commitment to that innovation, to really making a sizable mark on our industry and making sure that we continue to do this together. Because you know as well as I do, it certainly takes a team that you just mentioned. This is not easy, but it is doable when we work together. We're going to discuss everything and more after we get back from thanking our community champion sponsor. Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow. All right, we are back with Kent Dix, CEO of Life365. Kent, thank you so much for teeing it up on the front end. We have a lot to discuss today. Obviously, we have to get into founder's journey, how the organization came to be in the first place. I know there's aha moments in there. There always is when we have a founder like you on the podcast. Can't wait to discuss that. Of course, we then got to look at what's happening today. Where is the organization? What are you guys solving? How are things happening and going in the marketplace for you today? Then, of course, we've got to grab that crystal ball off the shelf, look at a little future state. What are you seeing from the captain's chair? What should we be mindful of as fellow thought leaders in this industry that are tuning into the podcast? And then, of course, we can't let you leave until we figure out a way to help you and the team out. But Kent, let's take it back. Let's rewind the clock. Let's talk a little bit. How the heck did this all come to be? Where were those kind of aha moments? Where were those triggers to say, you know what, I'm going to found this company? Where did all that kind of line up and put you into where you are today?
You know, it's interesting. I've had a very entrepreneurial family, actually, very entrepreneurial from a very early age from that as well. So I knew that I was going to choose an entrepreneurial route from that perspective. And I knew I was going to choose a technical kind of route as well. But I started out in corporate America and then realized early on that I really want to try to make an impact through inventions. It was my first company. We were in staffing, but we're dealing with secret and top secret projects. From that standpoint, we started seeing, placing kids that were up in North Dakota that were flying drones and also trying to get biometric and physiological data remotely from troops that were throughout the world, right? From that as well. And quickly realized that we could do that in healthcare as well. There is a lot of people that are sitting out the purview of our healthcare providers that are living in rural communities. And we don't know what's going on with them on a regular basis. We're finding 20 years ago that healthcare providers were starting to leave rural communities and people wanted to be able to stay and live in their communities, but still have access to care. So we started inventing technology with my first company that was probably one of the first IoT or Internet of Things of healthcare in connecting devices together, scales and blood pressure and pulse oximeters, and then sending that data up to the cloud, right, to be able to be viewed by their doctors. With a lot of things, we were early in this process. We didn't have reimbursement at the time from that, but it was a nice to have in the industry. And we eventually were sold to a $5 billion publicly traded company that allowed us to be able to start connecting patients remotely in labs and rapid diagnostics and stuff. I quickly learned through that experience that we're getting older by the day. 10,000 people are turning 65 each day, that we are getting sicker. It used to be when I started that healthcare spend was $2.5 trillion. Now it's going to approach $6 trillion by 2027. And the number of people when I started was maybe 60% had over 65 had one or more chronic diseases. Now it's up to 80% that have one or more diseases that are over 65. So we are hitting, I wouldn't say the tsunami, right, that's out there, or the senior tsunami, is where we're going to get people that are a lot older with those chronic diseases that we need to have care providers taking care of them. And we're going to lose 800,000 nurses and doctors by 2027 from the pandemic to 27. So technology is going to play a lot bigger role in this. And so that's the role of what we did with our new company, Life365, is we knew that we needed to start being able to get into rural communities, get into organizations where they needed access to care, to be able to get data to feed analytic and AI systems from that, and to be able to get early insights and start moving from reactive care, which is done a lot of times right now. If somebody gets sicker and goes to the emergency room and goes to the hospital, to move it to proactive, preventable, and predictive care, right, from that as well. In fact, I use 5 Ps, which is proactive, preventive, predictable, personalized, and prioritized care, right, from that as well. Data is going to play an incredible role in driving the AI and analytic systems that is going to consume us now over the next 3 to 5 years.
I mean, it really is. And you mentioned there's so many great nuggets that you just laid out there, Ken. You mentioned this, whatever we want to call it, a tsunami, whatever that might be. It is coming at us full bore. And this is something that we have to address. We've got to figure it out. And, there's leaders like you that are going after it and trying to really wrap our heads around it, not just through technology, but how do we get into those communities as well? I think it's all really, really important, Ken. And thank you for kind of sizing it up. But of course, you and the team now at Live 365, you are now over 9 years old. Let's not let that be lost. Any startup getting past year 3 is a huge deal. Now, 9+ years in, that's a heck of a feat. Can you share what it's been like during those 9 years? Has it changed? Has the vision changed much? What has it been like running that company for now almost a decade?
In healthcare, there are longer cycles of putting companies together. I mean, things just don't move that fast. They're out there. Even though we're moving to value-based care right now, and I'll get to your answer, probably 90% of the health systems are still doing fee for service, right, from that as well. And a lot of times when we were starting back in 15, 16 timeframe, we didn't have reimbursement in place. We learned a lot from our previous company. We realized that we needed to go with lighter technology, sensor technology, but we had to wait for reimbursement to get there, right, as well. We also had to navigate around COVID, right, and the pandemic from that as well. We knew we could drive value and value for hospital systems. But when COVID came around, everybody was on mission to try to keep people out of the hospital, right, from that perspective. But they didn't have money to spend on these type of initiatives, right, for remote patient monitoring and stuff that's out there. But they have to now. It's interesting. We're moving from a place in the industry where it was nice to have the technology to be able to monitor people from home, but it wasn't necessarily required. We're now moving to the place where it is now required to have that technology. Health systems are going to be managing larger populations, payers are too, larger populations of patients, and AI is absolutely going to eat our lunch. It absolutely wants to consume data. And we have to move to those proactive models, which the AI needs. Doctors don't need any more data, but the AI systems do. So we have to be able to get actionable data from the endpoint and feed the AI so they can manage larger populations, so that they can be effective under their value-based care plans that are there as well. I kind of show a chart when I'm talking about this, like what are the inflection points to create these trillion-dollar markets? Like when we had the IBM personal computer, it created all these applications that were there, or the invention of the internet, all these applications when Al Gore created the internet, or, the smartphones, right, that are out there. But what is driving that trillion-dollar market today? It's AI. AI is going to do it, right? And we can't be in a mode with value-based care and waiting for people to get sicker and then go through and try to be responsive to them. We've got to go shift left, get way upstream from that and get data earlier so we can intervene earlier.
No, bravo. It's absolutely spot on. It has to. I mean, it's a must. We need to go there now. I understand, and you said it earlier, quite a bit, if not the heavy majority of health systems today are stuck in the fee-for-service world, right? And then we're starting to see some folks having one foot on the dock, one foot in the boat, but we have to get there, Kent. Couldn't agree more. Let's really now transition into kind of current state. Obviously, like I said, 9+ years in with the organization. But if we're talking today, who is Live 365?
It's interesting. In the RPM marketplace, which we don't like to be considered RPM, we're a virtual first platform. There are a lot of RPM solutions that are going after a very small amount of the market, maybe $100 million in market in the US. From that perspective, we are going after a very significant part of the market. We've been very, very fortunate to be a part of the VA, Remote Patient Monitoring Initiative. So my passion started with my parents and monitoring them in rural Iowa. Right from that, I'm connecting them to the doctor and to their family. My passion is working with veterans to make sure that they stay connected to the doctor and receive care early on because of the waiting time, right? There was a lot of time and increase their access to care. I personally have testified in front of the Veterans Subcommittee on Veterans Affairs, Subcommittee on Rural and Highly Rural Veterans. From that, bringing new technology to the marketplace to try to connect veterans, right, together. So the veterans are a big, big passion for me. The other thing is our partnership, which I'm very, very proud of with Microsoft. Microsoft is trying to solve the problem of scalability of simple, repeatable, scalable, right from that. And a lot of times RPM does not scale because there's a lot of friction points along the way. Maybe it doesn't have reimbursement, but lack of interoperability between EMRs and EHRs is still a real thing. Trying to get data from home into the back of the EMR, EHR cost effectively is a real thing, especially when you want to be proactively. We are part of a team that's part of Microsoft Fabric. Fabric is connected out to thousands of health systems, providers, and payers that allow for us to be able to bring a simple, connected solution into the patient's home. It comes into Fabric through us, and then it goes in to the clinical backend seamlessly so that the health system does not have to try to go navigate with 200 different disparate device companies out there. They can do one connection point into Microsoft Fabric and solve their data problem in the back end.
That's pretty darn powerful. That's a lot of digital health entrepreneurs' dreams of what you just described. That is an absolute home run type of partnership. Very, very exciting there. Let's go back to what you mentioned. You said that you did testify before Congress around, mHealth and for Veterans Health Affairs, et cetera. From your perspective, what policy changes do you believe are most critical to accelerate the adoption of these digital health solutions?
It's interesting. I actually kind of showed this recently to send it out to RFK Jr. and to Dr. Oz and to some of the heads of the Veterans Affairs Subcommittee and House Subcommittee on Veterans Affairs about how we've been working for the last 15 or 20 years to try to listen to the problems that are facing us as a country right now, especially with our veterans, right, and our seniors. And I was getting that from Senator White and Senator Whitehouse and some of the others that we've been working with. But then we showed them technology that we can use, right, to be able to start connecting remotely to solve some of these problems. Then we continue to educate the congressional staffers on what's coming over the last 15 years. And then now we've been blessed to be able to implement it at the VA from that as well. So we've been able to go through and demonstrate to the government fairly effectively. I consider us like the efficiency that DOJ is looking for. The agency, they've asked for this over the last 15 years for us to handle this silver tsunami that's coming, and we're showing them, and now we're implementing it right as well.
Very exciting. And thank you for that, Ken. There's important conversations to be having and making sure that we are doing that education, especially during these important and crucial times. Let's also talk about the platform itself. Life365's platform is powered by your proprietary name, Personalize, with a YZE at the end. Can you explain how this proprietary engagement analytics engine works to match the right technology with the right user? And of course, what impact you've been seeing on a patient adherence level as well?
So we use the right phrase a lot, right technology, right user, right outcome at the right cost, right? From that, the biggest thing that we see with any type of virtual first or a remote connected care is engagement of the end user from that standpoint. I use my parents a lot as examples when they were living in rural Iowa. From that, my mom had 3 computers, 2 tablets, and chronic conditions, but she would able to engage and connected to their care providers at a moment's notice. My dad was completely off the grid to do this. So it's incredibly important that we use technique to be able to align the right technology with the right person to try to get them connected and into the system. So my dad would have to use a system that was maybe a cellular device that everything's already integrated and to be able to use. My mom could be able to use wearable devices, right? Or text messaging or other things that would be able to get her attention and keep her going as well. It's interesting as we work with some of our clients like White Plains Hospital, at the very beginning, when reimbursement was just getting established, they started looking at very cost-effective solutions to try to put with patients because you're trying to make the economics work. And so, they had heart failure patients and they had hypertension patients. And the first thing to look at is like, can we have the patient download an app and then send them out Bluetooth devices and to be able to take their readings and send the data to the cloud? Well, you already know the end of the story, right? From that standpoint, if somebody's not feeling good, they're a congestive heart failure patient, they may be 80 years old from that, or maybe younger. They're not necessarily going to be wanting to go through and pair Bluetooth devices and use their bandwidth and try to keep things going. From that perspective, we found it was much better to be able to deploy cellular-enabled devices, whether it's a cellular hub or a cellular enabled scale or blood pressure or a glucometer that's out there, to be able to have it just come out of the box, be able to take their readings and go directly to the cloud. Technology should be invisible when it comes into the home, right? From that, they should be seeing stuff that they just normally use in their own place. So there's a lot of lessons learned that we've learned along the way to implement best practices to get maximum engagement as well. We also really quickly use a company that does conversational AI in this as well. Our personalized system allows for us to be able not only match up the right technology with the right program to get the right outcome, but with the right user as well. A lot of people are using AI to like predict analytics for disease state or maybe treatment. We're doing it more from the engagement side. So the other part of the AI model that we're using allows us to be able to engage through speech and the device that is listening and communicating in a very conversational way. So it may go through and say, Kent, you've been really good at taking your readings lately, but I noticed that you haven't taken your readings today. Is there something the matter, something I can help you with? By the way, did you see the new movie with Harrison Ford over the weekend? From that, how's your dog Sparky doing, right, as well? And so it has to be engaging to the person to keep them engaged in their care, to keep them going and keep them compliant.
Well, let's also talk about your organization's focus on enabling this proactive virtual first care approach, as you've kind of been highlighting throughout the conversation. Let's ask a specific question around that, Kent. How do you and the team measure success in shifting healthcare from reactive to proactive models, which is, of course, a lot of people are thinking about right now? How are you viewing that question today?
It comes down to not only engagement, but it also comes down to numbers that have been set as well. At White Plains, when we adjusted models, though, we talked about the app going to cellular. From that, we absolutely have moved to a reduction in readmissions rates. In fact, it's been published recently to 2.6%. So it went from the low 20s, right? From that, and usually if you get to the high 8s or 9s or 10s, that's a great success. This one went to about 2.6%. And part of the reason was deployment of not only the right technology with the right person, like the cellular devices that we did, but also some hand-holding along the way too, right? So we've got partners that are out there that are ambulance systems like AMR Ambulance, right? That is the largest ambulance company in the world. They have to find new ways to start working with patients at home. It can't be where you just go through and take a 911 call and then you ship out an ambulance to somebody. Somebody had to get sicker, then they're shipped to the emergency room. Half of their calls are not calls that should go to the emergency room. So they actually started doing some programs where they would triage with the 911, the call, and maybe it's the social determinants of health call that's out there. And they would actually send an Uber or Lyft out to the patient and take them to where they should be going and not to the emergency room. So ambulance companies, I think, are going to start transitioning more into being part of that care and doing fast response teams. When I'm going through a data about Kent Dix, you may see electronic health records, you may see claims data, you may see genomic data. A lot of times that data is old. I mean, I'm talking weeks old or months old from that perspective, but it gives great insights to AI for learning, right? So it can learn really quickly. You could say, anytime Kent's blood pressure gets above 180 and his SpO2 or oxygen gets below 85, and he gains more than 4% of his body weight overnight, he's going to head to the emergency room with congestive heart failure over the next 7 to 10 days. That's what we want to know. We want to know, can I intervene earlier? Can I start prioritizing Kent earlier? But the thing that I need to have, and this is where Microsoft comes in with Fabric, I need to have the observations of what's going on with Kent today. So on those observations, I say, whoop, blood pressure is above 180 and SpO2 is below 85 and he's put on weight overnight. From that, retaining fluid. Maybe we should schedule a fast response team instead of an ambulance to either intervene over the phone or in his home and schedule an appointment to try to get him stabilized at home instead of waiting until he decomps to go to a more critical expenditure, right? So that's where I think the beauty of AI is coming into this as well.
No, absolutely. And it's coming at it. It's here. I mean, let's just call it what it is. It is here. It is making a mark, not only in our own personal lives, but now really entering in full steam into healthcare, which I'm all about. I'm a big fan when done appropriately. Ken, let's also shift gears a bit. Let's talk a little dollars and cents. Let's talk about the business side. You mentioned it earlier. Obviously, we're now, accelerating up to a $6+ trillion industry. It is incredible at the pace of how much we are spending in this industry. And then also too, I've noticed in some of my research leading up to today's conversation that you've emphasized time and again, this notion that one solution does not fit all in healthcare technology. I agree with that. But let's take that kind of comment that I've seen from you, and let's also talk about cost effectiveness. How is your organization's hardware agnostic approach addressing the challenge of this one size does not fit all, but also maintaining cost effectiveness?
I think it really comes down to platforms, right? From that standpoint, platforms, I think, are part of the thing about integrating into common platforms and being able to go through and select the right technology for the right person. I don't want to be able to go through and see the example I use is like, I'm going to give a laptop to every millennial out there to try to keep them out of the emergency room. First of all, they're probably not going to the emergency room, right? From that. Second of all, you can't afford the ROI to do that. So you're going to want to look about the integrated solutions that are on the platform. You're going to want to look and see how Ken engages, right? From this, you're going to want to look at the economics and the ROI from this as well, and try to pick the right solution to try to nudge Kent into compliant or be proactive. I personally believe, I talk about shift left a lot. I use a lot of this bell kind of curve, right? From that, and complex care is on the right-hand side and health and wellness is on the left-hand side. We want to shift away from the hospital and try to get to people, whether they're just starting to spend dollars maybe, or they're newly chronic from that perspective. If you can start using lightweight technology, I don't care. It could be Apple Health Kit, right? From that as well, and start taking data in that allows you to start seeing some trends in Kent and not diagnose off of it, but nudge Kent into compliance from that. That maybe solves 70% of your problem without you having to wait until they get sicker. So that's the reason why we partnered with companies that do voice biomarkers, that do disposable sensors, that do facial acquisition of data from that. Let's not forget, if you start doing some of this stuff, some of it may have to be FDA regulated and cleared, right? Depending on what you're doing with the data. But there is data, as long as you don't show it to the patient, as long as you don't show it to the clinician, as long as you're not making clinical decisions off of it, if you want to go through a behavioral change and nudge somebody into compliance from that standpoint, use the data to do that from that perspective. The biggest thing to get over, and sometimes they get booed for this, is you don't need to have the most accurate, most expensive device at home to be able to do that. You may be able to use a smaller, less expensive device that gives me some trends and patterns to be able just to remind you, hey, did you take your medication today? Right from that, right? Or, maybe you need to call your physician, right? From that, or go back to your prescribed therapy, right? From that. It's not making decisions. It's just trying to nudge you back into compliance.
And let's also talk now a little future state as well. Ken, obviously things are moving quite quickly. We've been talking about it through this entire conversation, but looking ahead 5 to 10 years, how do you envision AI and machine learning transforming the remote patient monitoring landscape? And of course, particularly for chronic disease management that we've been discussing. And of course, in that as well, where is your organization going to be? How is Life 365 going to be participating in that future state as well?
So I was just at a conference last week in Silicon Valley with investors, and they're seeing the meltdown, right, that's occurring in the stock market from that perspective. One interesting point, when I was up speaking, I'm like, anybody look at the stock market today and you see everything is a sea of red, right? Of course, these investors are kind of laughing and panicking at the same time. But when you scrolled up to the bottom of the page, it was all green. And what was that, all that green? It was healthcare stocks. Healthcare stocks are bellwethers going forward, especially in these critical economic times, because people are still going to be sick from this as well, right? So where is AI going to lead us? The one thing the investors said is, in the world of AI, not necessarily just healthcare, but the world of AI, in a 9-inning ball game, we're still in the first half of the first inning. I was at a conference with Microsoft 2 weeks ago, and it was for Fabric, and 6,500 developers were in a stadium. And basically they said, listen, here's something you guys would have coded in 3 months. Here's AI doing it in 3 minutes, right? So basically they just showed all you developers, we just eliminated your job. From that perspective, you're going to have to do something different in the future. AI is going to move so fast. It is going to be the catalyst to redefine how care is administered from that. It's very, very clear that AI is going to help enable the consumer and the payer to make decisions, right, that are out there of where and how they receive care in the future from that. So organizations that are kind of waiting this out a little bit, there's no waiting it out anymore. We're full blown in the middle of it.
Now's the time to roll up the sleeves because it's here and it is only accelerating. It's sitting on the sidelines is no longer an answer to where we are currently at, and more importantly, where we're headed and heading quite rapidly. So fully on board with those comments. Kent, let's bring it back to current state. Let's get our community involved. What's one problem, need, or question that you and the team have that our community can be helping you with?
I think probably the education around, engagement from that standpoint, the education around reimbursement, right, from that as well. And also the policies around using AI in healthcare as well. I mean, there are going to be some challenges around where does AI start and where does it end, especially in our lives. I have people around me that basically say, I'm never going to use AI. It scares the hell out of me to do that. Well, then stop using your phone, stop using Netflix, stop using Amazon, right? So in the future, stop driving your car as well on GPS, because it's going to be all around us and consume us. But I think there's going to be some ethical considerations around use of data from that perspective, use of AI, how far it goes, what kind of decisions are made from it as well. And I'll turn a little bit. I mean, we haven't had huge consequences quite yet, but unmanaged, it could have some consequences. And I think we need to get ahead of that a little bit.
And for our community that wants to have those conversations with you, Kent, how do they get a hold of you? Social media handles, websites, or otherwise? How do they track you down online?
So kent.dix@life365.com or .health, either one, or my LinkedIn, Kent Dix on LinkedIn.
Excellent. And for our listening community, just simply scroll down in your favorite podcast player where you're accessing this episode. Those contact points will be listed for Kent and the team. Of course, you can head over to our free global online community at passionatepioneers.com. There will be a post for this episode where you can leave comments, feedback, suggestions, or otherwise, as well as get a hold of those contact points for Kent and the team, again, over at passionatepioneers.com. Kent, what a wonderful conversation. But of course, before we let you out of here, we do have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
I like to help people.
I love it. Short, sweet, but very, very impactful. And that is exactly what you and the team are up to. Kent, thank you so much for taking the pit stop during your very busy day. I know how much you have going on with the team, leading the charge with Life 365. Thank you for coming and telling the story and sharing with everything where you guys are at today, where you're going tomorrow, and how we can all get involved. But again, Kent, thank you so much for being with us today.
Thanks, Mike. Thanks for having me.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.